Hello, I'm Dr. Lavender, and I see that you are in today for a cranial nerve exam. Perfect. Can I get your first and last name? And how do you spell them? Okay. And your date of birth? Beautiful. Let's see here. An address. Okay, and a P.O. box. Okay. Alrighty. So do we have any family history of any known medical issues? Okay. And are we on any medication? Alright, how many times a day? Okay. Same pharmacy. Beautiful. Okay, and looks like your insurance is all set up. That's great. Well, we're going to start the exam with just some basic vitals and then moving on to the cranial nerve portion. So today it's going to be a little bit unpredictable, a little different from your average cranial nerve exam. It is a new technique that's being developed, but it is showing some extremely promising results in the latest studies. So it will be a little fast as well. If at any point you feel overwhelmed or uncomfortable, just let me know. The speed is kind of designed to help stimulate your senses. So let me put my gloves on. The good thing is you should be out of here in 20 to 30 minutes. Did you take time off work or school? Got it. I can always write you a note. Okay. So, let me just get a look at you really quick. Do I have your permission to touch you? Okay. So, just making sure, there's no obvious signs of anything going on. Alright, looks good there. I'm going to just there we go. Then I'm just going to take a quick look there. So we're still just getting a general idea of the face before we begin the cranial nerve portion. I'm actually going to measure. Okay, looks good there. Looks good there. It's a little bit big, but nothing to be concerned about. Just going on the side. Good. Good. That's perfect. Alright, everything looks good there. I'm going to take your temperature. I'm going to stick it right in your nose, okay? Perfect. I'm just going to listen to your face, so I'm just going to get a little close. Alright, now take a deep breath in through your nose. Okay, on your forehead now, so another deep breath in. Great, and then here. Your face sounds great. So, Okay, so now I'm going to get your pulse. I'm going to put my hands right there, so don't move. Got it. Alrighty. Well, we're going to go ahead and start the cranial nerve exam now, beginning with your sense of smell. So, I'm going to spray this, and you tell me what you smell. Perfect. One more thing. Okay, so I'm going to ask you to tell me what this smells like as well. A little closer. Got it. So that's just your sense of smell. We're going to move on to your eyes now. Just looking to make sure that they're even, that they don't have any signs of drooping or redness. They look good. How are them? Under the eye bags, it's looking good. Alright, so I'm going to get my light. Alright, just looking in your eyes. There we go. Looking in your other eye. Perfect. Going to lift it up. Going to pull it down. Pulling it down. Lifting this lid. Looks good. Okay, I'm just going to run it across. Run it across. Run it. You see that okay? Perfect. Okay, so look at my finger here. Over here. Great, now look at my nose. Perfect. Look at my nose. Great. Same thing on this side. Look at these fingers. Great. Great, now focus here with both eyes. Don't pay attention to my fingers. Okay. Beautiful. Alrighty. So, can you go ahead and look up, look down, cross your eyes. Just going to feel around. No pain, right? Great. Alrighty. So follow my fingers. Okay. Yep, go cross-eyed. Beautiful. And then tell me when my hand leaves your sight of vision. So stare at my face and just let me know when you don't see my hand anymore. Good. Keep staring at my face, please. Good. Same on both sides. Good. Good. Oh, okay, there we go. Alrighty, your eyes are looking good. Going to do the swinging light test. Everything looks good there. You have great eyes. I'm going to ask you to read something for me. Okay, so I'm going to hold a board with letters on them, and I'm going to ask you to read the word. Ready? What is this word? I know it's a little bit hard to see. Purple. Red. And down here. What color is this? Pink. Exactly. So you had no problem seeing these, right? Great. Next, we're going to continue testing your color perception. Okay. What color is this? Perfect. What color is this? Okay. And this? Okay. And this? I'd actually say it's more of an orange than a yellow. color? Alright. Which is your favorite? Well, you get to keep that one. Alright, next we're going to check your jaw. If you feel pain, how about here, here, here? I'm going to touch this area. Here, behind your ear. No pain? All good? Alrighty. I'm going to ask you to chew this piece of gum. Say ah. And while you chew, I'm going to hold my hands here. It's bubblegum flavor. Alright, your TMJ feels great. Go ahead and keep chewing that. That's for you. Alright, so you taste the bubblegum. Great. Tastes like normal bubblegum, right? Excellent. Alright, pause the chewing really quick and open your jaw. Okay, and clench it. I'm going to hold your chin right here and try to open it against my pressure. Beautiful. Alrighty, let me just feel your face here a little more. Everything's looking good. I'm going to go ahead and have a look inside your mouth. So if you want to put the gum back in its wrapper for a second. There we go. So I'm going to hold your tongue down with this. Now your breath smells really good, so win-win. So I'm just going to look inside your mouth. Inside your mouth one more time. There we go. Looking, just like making sure your tonsils aren't swollen. Your tongue looks good. Just looking at it like that. Mouth looks good. I'm going to lift your tongue up with this. Alright, I'm going to tap your teeth. No pain or sensitivity. Great. Okay, so now I'm going to look in your ears. So just getting kind of close here, looking. Looks good. Looking over here, looks good. So this one could use a cleaning, I think. I'm just going to clean a little bit out of this ear. I'm going to grab your head so you don't move. There we go. Perfect. And on this side, just clearing a little bit of the wax. Like that. Now I should be able to get a better look. Alright, your ears look great. I'm going to perform a few hearing tests, so stare straight at me and tell me when you hear a noise. Okay, now tell me when you hear a noise on this side. Great, I'm going to try a different technique. So, you hear that? You hear that? Alright, I'm going to make some noise over here. Whisper a number in your ear and you tell me what number that is. 1,000,005. And then on this side, okay. 42. Wonderful. Tell me if there's any pain at all. I'm going to tap. Great. No pain. I'm going to cover. Tell me if there's pain. Can you hear me? Okay, one more time. Wonderful. So it and place it on your nose, and you make sure that you hear it on both sides equally. Okay, now close your eyes. Close your eyes. And tell me which ear you hear it on. Okay, now I'm going to hit it, and you tell me when the noise stops in this ear first. Okay. Wonderful. So next we're just going to be testing some muscles in your face and in your tongue. But before we begin, I'm going to be applying this solution. So just stay still. Quite cooling. Trying to relax a little so that we see that your face muscle is working as best as we can. This is all part of the new method of doing a cranial nerve exam. Okay, and then just going to there we go. Alrighty, so can you stick your tongue out? Wiggle it around. Okay, puff out your cheeks. Raise your eyebrows. Furrow your eyebrows. Okay, and then frown. Smile real big. Make a kissy face. Alrighty, and then roll your head side to side. Please don't roll it all the way back. Okay, raise your shoulders. Okay, I'm going to hold down on your shoulders and push down, and you try to raise against my pressure. Wonderful. Well, it looks like you are passing this cranial nerve exam with flying colors. Congratulations. I'm just going to feel your neck, your lymph nodes, make sure nothing's swollen. Just kind of get close here. And your head. Okay, wonderful. So next I'm going to be touching your face with a firm plastic and a squishy silicone. So I'm going to have you close your eyes and you try to tell me which I'm touching you with on your face, okay? Mm-hmm. 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 Perfect. Wonderful. Okay. Please keep your eyes closed. Perfect. And then touching there. Okay, I'm going to touch both at the same time and you tell me which spot the hard plastic is on. Wonderful. Now I'm going to be using this tool to gently feel around your face and just make sure that there is no pain again. No pain. You are doing great. So the last thing is a new medical invention, a new medical tool. I'm going to put this into your hair right here on the cap of your skull, and it should elicit a certain response, and I'm just going to be making sure that it's eliciting the correct response and just that all the sensations in your scalp are okay. Are you ready? It will feel quite ticklish, as you've probably noticed. Just let your body react how it wants. There we go. Perfectly normal. So I'm just going to get some outtake notes. Okay. So no pain experienced throughout the procedures. Okay. Alright, and vitals were completely normal. Measurements were normal. Olfactory, we had optical nerve, reflexes. Alright. Did a little bit an area of concern. I'm going to perform one last test. So just stay seated. I'm going to tap this on various parts of your head, and that should elicit once again a certain response. So just let your body react exactly how it would. Don't try to control it. Are you ready? It won't be painful at all. Okay. Good. 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 Alrighty, well that was perfectly normal. So that check was completely normal. Alrighty, well everything seems completely normal. You will hear from us in about a week with your full results, and probably sooner if we find anything of concern once we actually look at the data. Well, it was super great working with you today. As always, I'm only a phone call away, and we also have an online portal where you can shoot me a message.